It's because we do try and share the link with for the folks who can't join us at this time. So happy Wednesday, everybody. Thanks for joining today. So far, it looks like we have 314 participants, and I'm sure that there are a few of you guys that are sharing, hopefully, but social distancing, looking at the same computer monitor out in the office space, but hopefully staying apart while sharing a space to watch this question answer session as well as update. It's a beautiful day in here in Little Rock. I hope it is wherever you guys are too. We are bringing back the sharing of stories from the county offices. I love that many of you are emailing and sharing the work that you're doing out there in the field. I love seeing those stories of how you guys are still connecting with families and really changing lives and serving children and families. And so before we get to Jana, we're going to hear from Jana Anderson in Area 1. Again, we're having a little technical difficulties with that. But in the last couple of weeks, a few differential response stories have come in. And one of those is from Area 1 and Jana Anderson. But also, I'd like to give a shout out to Area 4 and Angela Newton. It got shared with me that she was working on a differential response case with a 17-year-old autistic child and was able to work with community providers to get her a new bed, and she also did some really great work with the family. So great work to Angela Newton and the team there in Area 4, and thanks to you guys for sharing it with me. Also, I'm going to give a shout out to Jennifer Carroll in Area 5, Van Buren. Now, this is quite the interesting story too. Someone at OCC saw a Facebook post from a family who is in need of food and some other assistance. And so without even a hotline call or otherwise, Jennifer took it on herself to reach out and make sure that that family had food, diapers, wipes, and connected her with the local food pantry. The family thought that they did not qualify for SNAP, but Jennifer connected them with DCO and they got their SNAP application in. And so I think that that is just a wonderful example and shows the heart of Jennifer and her team there in Area 5 in Van Buren County to serve communities. That is true prevention. You know, really in and serving a family before they get to a point that they have to have our need. Oh, I have some bad news. It looks like Keith is IMing me, telling me that we can't seem to get the microphone or video to work for Jana Anderson in Area 1. So I'm going to give Jana a shout out, and we're going to just try and reschedule her to be on next week. But another great story on a differential response case where she was working with a family and worked with one of the local stores to get a significant discount and make sure that the family had a washer and a dryer so the family wasn't having to drive across town to continue to do the laundry. And there's more to that story, but you know, I don't want to spoil it too much for next week. But I just think that these are all such great examples of the heart of you guys out there to really serve and continue to serve in this difficult time through this public health emergency. And so I love hearing it, and I know that staff across the state are always encouraged to know that there are more of us out there that are continuing to work and serve families. So thank you guys for all that you do. So I'm going to move on to my next segment, which is always about permanency and safety, which has to continue to be our focus during this public health emergency. So I'm going to share my screen. We had some technical difficulties last week getting the data out. Hold on a second. I'm not sure if y'all see that or not, so hold on. Give me just 1 second. I want to make sure I do this right. Of course, I'm having technical difficulties. Give me 1 second. Bear with me here. I just practiced this before I started it. Okay. Okay, I am really struggling today. I just practiced this before. I was trying to share the data. For some reason, it is not giving me the option to do that now, unless I already did it and y'all see it and I just don't realize it. That's what I get for they said I was getting bold trying to do all this technology at once. And apparently I got too bold. So I cannot seem to figure out how to share the data. So I'm just going to walk through it really quickly. Hopefully you can put me on a small part of your computer and then pull up the email from Kristen Harper as I walk through the data that just came out for this week. And I want to start, I always like to start with the positives and look at discharges. Well, for this week, it's truly the discharges. And, you know, discharges relate to permanency and the different types of permanency. So as you can see on the discharges tab, we're looking at reunification, adoption, placement with relative, placement with a non-custodial parent, guardianship, and place with non-relative custody. And you can see those total discharges up and through April 25th, we saw a significant increase in this last section back up to 103 discharges for the time period of April 11th through April 25th. So very excited to see that, you know, we're seeing increases in permanency for our kids. That's so important. You know, I talk about that every week, that foster care really just should be a short-term intervention. I know that last week I got a couple of emails afterwards from courts that were not having hearings, and we worked closely with our OCC leadership as well as the Ad Litem program, and we're able to resolve those two particular issues. So I just, please, if you're seeing barriers to permanency, don't just sit back and say it's a public health emergency, we can't do anything. Really try and lift those up to your county supervisor, your area director, talk with OCC, ask if they're talking with their supervisor, and let us all try and brainstorm ways to address any type of barriers to permanency. So thank you to the two areas that lifted those up last week and worked closely to find solutions. So I'm excited that the courts are back to having video conferences, but permanency is bigger than just having court hearings. We have to work the cases and offer services and continue to work with families to move kids towards permanency. So I'll also go through some of the other tabs on that Excel spreadsheet around safety, initiations. You know, we're continuing to see some increases in some areas. Some areas are continuing to struggle. So I beg you that if you're an area that is continuing to struggle with initiating investigations, that you're really digging in and figuring out what those issues are on the local level. If there are issues that you don't feel like you can resolve at the county level, please raise those up and see how you can get additional support and what we need to do. Because from every level of the agency, safety is a priority. We want you to solve issues at the local level. We want you to address barriers. We want you to figure out how to manage your resources. But at some point, if that's not doable, we want you to then message that up and see if we can work as a team. Because in the end, we want children to be safe, and we don't know if children are safe if we're not seeing the children. I'd applaud the areas who continue to really excel in the initiations. I know that it is tough and difficult to get the work done right now during this public health emergency, but I applaud you for figuring out ways to make that happen. Moving on to placement with relatives. We saw a little bit of a decrease from April 15th to April 21st, not significant enough that I'm worried about it, but I'll just bring up on these calls that, you know, continuing to really look at relatives, maybe in a new and a different way, is so important for our kids, because we know that what our relative data shows is that kids are less likely to be abused, more quickly to permanency. And so relative placement statistics and looking at the bigger picture really is good for kids. Oh, great. Okay, Keith is IMing me and telling me that she's rejoining via phone. Jana is going to rejoin via phone, so I'm hoping that we are going to hear from Jana today. So I apologize that we're a little all over the place, but it's technology and we're just making it. Let's see here. Stay tuned, he says. Keith says stay tuned. So moving on to foster care visitation rates. Now, I'm not going to lie, guys, I'm getting a little worried. I'm getting a little worried about some areas in both the foster care visitation rates and the protective services visitation rates. You know, we're getting towards the end of the month. So if for some reason you are one of those workers who has major visits but hadn't documented them, really now is the time. But I also encourage you that if you haven't made a visit, this today, tomorrow, it's time to make your visits a priority. And again, not just about the number, but about quality. We really can't serve children and we can't protect our most vulnerable population if we're not seeing those kids. Now, there's a lot of areas who are excelling. I applaud the areas who are getting creative with the video conferencing, using different technology. So again, just making sure that you're digging into your county numbers and really looking at what's going on with your visitation and making sure that your protective service cases are a priority. I know you're tired of hearing me say it, but they are our most vulnerable population, our PS cases, but sometimes get the least of our focus because our foster care cases have priority because they get court cases. But especially during a public health emergency and a pandemic, when these children are having less contact with schools and other mandated reporters or professionals, now is really the time that we have to make sure that we're either having face-to-face contact with these families when necessary or connecting with them through technology as appropriate. And so thanks to all you guys who are making the protective service cases a priority. There's a lot of good work happening across the state, but for the managers all the way up, it's really important that we use data to inform our work. But at the end of the day, it's the child behind the number. So digging all the way down to the worker, looking at the caseload, assessing priorities, and making sure that safety and permanency are our main focus for the next few months. So let me see if I can check in here with Jana and see if she is on again. Let me see. Let me unmute her. Jana, are you with us?
Yes, I think so.
Oh, how exciting. Now, you're via phone, right?
Yes, it doesn't work on computer.
So we don't get to see you today.
That's fine.
Well, I love seeing people's faces, even though I don't get to see them much in the office anymore. I think it's at least good to see people on camera, but I'm glad that you're able to join us on audio. I don't know how much you heard earlier, but I gave everybody a little bit of a introduction. You're housed in Washington County, right?
No, Benton County.
Benton County. So, and I hear that you recently helped a family in a really cool way. I'd love for you to tell us about what happened with that family and what their biggest need was.
Well, first of all, it was a family with two adults and a child that were disabled, basically living very limited income, paying too much for an apartment, but basically the call was put in for environmental neglect because the daughter wasn't able to wash her clothes or bathe. It was because the adults in the home would have to travel, take their clothes to the laundromat by foot, and he couldn't walk because he had COPD, or they would have to hire a cab to take them somewhere to get food and stuff like that. So bottom line is they had a space for a washer and dryer in their apartment. And, I taught them how to use the Walmart app, stuff like that. We were brainstorming different ways to approach it. But, with all the COVID thing, all the places to go look for used washers and dryers just kind of closed down. And last resort, with the encouragement of my coworkers, I decided to go ahead and be bold and ask the guy that has helped me with previous cases, the manager at Lowe's in Bentonville. And he delivered. I mean, it took a few weeks to get it all together, but he ended up allowing us to purchase a brand new washer and dryer for $400. And they delivered and installed into the home. And it just changed the life of these people. And, in the meantime, other things, we were working on food shortage and access to food because that was one of their main issues. But she just said, I'm so happy I can wash my sheets and all my bedding. And so it was just a all around good win-win situation.
That is wonderful. How do you go about really making those connections with the community partners? I mean, what you did in working with Lowe's, that's wonderful. Like, tell me how you created that relationship.
Well, the guy is just awesome. His name's Ryan Kelly, and he's down there. And when I told him what I needed and spoke to him personally, I emailed him. We just built a rapport, and he told me whatever I need to come to him, whatever, and that he would do everything he could to help our families. And
Well,
that's how it is. I mean, I never thought to ask for a purchase like this or something of this degree, but he did it, and it was awesome.
sometimes it's just about asking, right?
It's just about asking and building relationships. And I'm new, so I've only been here a year, working in this area. So it's in my hometown where I'm from, I'm used to that kind of thing. But it's just kind of getting the feel of who you can talk to, who you can ask, where to find things, those kinds of things.
And I suspect that you now have a good relationship with that family. So where there is a need in the future, before a situation gets out of control, you think that they'll reach out and call you?
Oh, yes. And that was actually, I just closed the case this last week, and I told her those were my parting words. If you need me, you can still call me, even though I'm closing the case, because they were able to access food and get stocked. I mean, I've had to take her to the pantries or go to the pantries to get food for them. I mean, they just had, and with the COVID, they were both adults were, not supposed to be out because they were at risk. So they were even more sheltered into the home and did not need to be accessing and going to the store and stuff like that. So there was multiple things kind of like I had to handle, like internet, food, being able to wash their clothes. I mean, it was like kind of a whole thing. But by the time I left, they were thanking me, and, I could settle it, that they were well taken care of and that they knew what they needed to do.
Okay, well, I really appreciate all you're doing and all the team, differential response staff up in Area 1 is doing. I know that you guys do amazing stories. There's several stories, not just this one, that have been shared with me over the past year. I know Ann Sherry, she's your supervisor, and she does a great job up there. So thank you guys for all that you do, and thank you for being willing to share with us, and for joining, even though we had some technology issues.
Hey, I just have to shout out to Ann Sherry, because she kept pushing me on this too, nudging me along. And if it wasn't for Dave Morris right now, I would have never figured out how to do it on my phone.
Okay, well, thanks to Dave too. Okay, thanks, Steve.
All right. Thank you.
Bye-bye.
Hey, bye-bye.
Okay, so I love hearing these differentials. Obviously, you can tell I love hearing these differential response stories, and really the work that we're doing to connecting with families. And that work that Jana shared with us, that is work that will prevent future maltreatments. Obviously, I don't have a crystal ball for those families, but research indicates that that level of work will prevent those families from coming back to us and having that future maltreatment. So super excited that that continues even during the public health emergency. So I know that I've gone over the data and I've gone over the shout outs for the stories. The last couple of things that I have are specifically COVID related updates. So I mentioned, let's see here, 1 second. I'm trying to mute Jana. Jana, you may have to mute because for some reason I can't mute you.
Okay, I don't know how, but oh well.
I'll mute all. Okay, here we go. Okay, so the COVID updates. Last week I mentioned the budget, and there's not a lot of updates other than I want to continue to keep you guys informed that we are working through some budget cuts for next year. We have no staffing cuts on the radar at this point. And really the focus has been on how we can bring in additional federal dollars to try and support that work we're doing. And so when I say budget cuts, I'm talking about state general revenue. But there has been some exciting news on the federal front as far as additional funds that we could use to support our work. But the important message for you guys right now, both to the end of the year and through next year, is that when we do best practices, we actually end up saving money. And what I mean by that is when we serve families on the front end, when we get them involved in services, when we do the work that we need to do to prevent future maltreatment or prevent foster care, we actually have cost savings. And so one example of that would be when we're really engaging with a family and helping them on an in-home case, if we are able to get that family stable, that is a much lower cost to us than bringing multiple children into foster care, having, say, their sibling groups, placing them in different foster homes, which causes trauma for the children. You have the trauma of the removal, trauma of being separated from their siblings, moves start to happen, and then before you know it, they're in high-end placements. And then before you know it, we can't find them another placement, so we end up paying state general revenue for a high-end acute or residential placement, which in the end costs us more than if we would have just done a better job on the front end of working with the family. So what I'm trying to say to you is sometimes when we start feeling anxiety about, oh, well, you know, DCFS doesn't have money, we start not serving families. In the end, we not only cause ourselves at DCFS more trouble, we're not doing what's right by kids. So I hope that the walk away for you guys is continue to work with families, continue to refer them for the services that we have in place, continue to look and assess whether there's a need that needs to be addressed, because ultimately we are doing what's right when we serve kids before they come into foster care. But if they do come into foster care, I mean, don't hear me say that kids don't need foster care. There are kids who are in immediate danger who need foster care. But once they're in foster care, we have to make sure that the services are available so that they can move to permanency. Because when we don't make sure that there are services in place and that we're working with families, they end up in foster care longer, which causes more problems for our budget. So we want to do what's right for kids first. And that's all that you at this point need to be worried about. We have no anticipated major cuts related to staffings. We have not cut contracts. We do have holds on expansions of services. So while we were very excited about some potential service expansions going into the next year, those are on hold right now. But like I said last week, we have a governor and we have a legislature who is very committed to making sure that we serve children and families. And if we continue to implement best practices around how we serve families, we are going to be okay. And I will keep you up to date if there are other things that come along that I believe really truly impacts the work that we do as it relates to our budget. The other thing that you've started probably to hear, both in the governor's press conference as well as through media and otherwise, is there is beginning to be a discussion about what it looks like to transition staff back into the office. We're at the point right now that we're just looking at initial conversation. We're just having initial conversations about that. We do want to learn from what has happened through the public health emergency. We want to learn from how we've used technology. We want to learn about, we want to look back and see what did we do differently? When I say us, I'm talking about DCFS. What did DCFS do differently through this public health emergency that has actually been good for our clients, for the children we serve, as well as you guys? Now, always our clients, our children are our first priority, but of course our workforce is important to us as well. So it's really a good time, especially in the next couple of weeks, for you as supervisors to reflect on what have we done differently that has worked and worked well, and making sure that you're passing that up to your supervisor so that we're taking that into account as we're also working with leadership to determine how we phase back in staff into the office. There's nothing that's going to happen super quick or urgent, I don't expect, but conversations are starting to happen. So we want to make sure that we're learning from what has happened and how we move forward as DCFS long-term, continue to use technology and other things that we've learned from this public health emergency. So I just wanted to put that on your radar. I have no specifics at this point to share with you guys, but as I get them, I will bring them up on the weekly call and talk about them. So I'm almost out of time, and you know that I like to take questions. Becky Dunnigan, if you're listening, I already see that I have questions related to safe measures, and so I'm going to unmute you if you can figure out how to add in. Let's see here. Apparently, it's not allowing me to unmute Becky.
Can you hear me?
Oh, yay! There you are, Becky. Can you see the question answers, Becky?
No.
Okay. Can you click on the question answers and see them?
And Michelle, you know I'm not good at technology.
Okay. We are a team today. So here's one from an
I think I found them. I think maybe.
Okay, well, I'll just read it to you.
Okay.
Safe Measures data is not accurate. We are submitting a request with the website for them to look at it.
Okay, and so I think that's great. They're submitting it to the website, but I've probably gotten, just in the last 3 weeks, 50, 60 emails myself, and I'm willing to take those emails because I like to also see and make sure that the Safe Measures team is looking into it quickly. So you can copy me. You can still go up to the contact us and copy me on that email, or you can send it directly to me, and then I can loop in John, the Safe Measures lead as well. Now, I will tell you, I've only found a couple that weren't correct, because you have to pay attention to, if you go up and what you're looking at. Are you looking at March, or are you looking at current data? So up at the top, and I'm very visual, and I don't have Safe Measures in front of me, but up at the very top, you have to click on and make sure you're looking at the actual correct data. But yes, we want to make sure that we're getting that data correct while we're continuing to build Safe Measures. So if you don't mind, please copy me on those emails. And again, there are many of you out there that I've been working with, because I've probably had 50 or 60 emails, and we have found a couple errors, but we've also just found making sure you're looking at the correct time. I even did a couple case reviews for a couple areas, and the documentation was incorrect. So it's got to be documented correct as well. So whatever I can do to help, just let me know.
And I know I'm past it, but I just shared the data on the Excel sheet. Well, next week, hopefully I'll do better next week on sharing screens and bringing presenters in. Thank you guys for hanging with me. So a couple other questions. We have some cases in other counties with secondary assignments that are not being seen due to being in therapeutic foster care. One foster parent doesn't have video capability, so if there's only phone contacts, this will show as a visit and will make numbers low. I thought if we triage, then we can still see client face-to-face. Okay, so we really need to figure out how to video conference with that foster parent, and if they are a TFC provider, then we need to loop up with the actual TFC provider to figure out how to make that happen. So I see that it's A Hope. I don't know if that's Miss Amanda Hope, but if that's Miss Amanda Hope, will you reach out to Megan Bush and let us know which TFC provider that is, because I'd like for Megan Bush to reach out to the TFC provider and us to figure out how to make sure that we are video conferencing, or at least the TFC provider is having face-to-face contact. Again, I'm not so much worried about the number on your visits. I'm actually worried about seeing the kids. So I think it's still important, even in our TFC homes, to make sure that we're having eyes on those kids, whether through video conference or through face-to-face. Becky, since you're on, is there anything you want to mention on that one?
No, I agree. Especially that being a TFC, we need to support the field staff in working through that, and Megan can help do that.
Okay. Mike Atlin, just wonder, oh yes, I will mention Walk for the Waiting. It's upcoming, though. Walk for the Waiting is not happening at the War Memorial Stadium. They are doing a walk for the, a virtual walk. And if anybody is interested or wants to do the fundraising for that, you can just Google Walk for the Waiting 2020 and the website comes up. And for the people who are new to DCFS, you know, normally we are obsessed with supporting our partners with Walk for the Waiting. Just during this public health emergency, we've had to focus our attention otherwise, but we are still super grateful for the 3 partners who are supported during that walk, which is the Call, Project Zero, and they are having a virtual walk. So if you're interested, check that out. Okay, if they don't have Wi-Fi at home, is it okay to do the visit in another place they go that has Wi-Fi? Okay, I'm not really sure what kind of visit you're talking about, but it really depends on, do you need to see the home to assess the safety? So, you know, is it a foster home visit? Then it does, or is it a protective service case visit? You know, what type of case is it? What is it that you're trying to do with those visits? Becky, you always do better with best practice, so maybe I can punt this one to you too.
No, I agree exactly with what you're saying. And even if it's a foster home visit, I think that we need to be seeing our children in their placement. And I would be very concerned what's happening if we can't see the child in the visit, in the placement. But again, that may be a case you really have to assess. Is it a foster home we've had concerns with? Is it a foster home that's newly open or only been open a few months? So we need to be looking at that and assessing and seeing what we can do. And it may be one that we have to triage to ask the questions that we put out in the triage about if they've been around anyone that's been tested positive, have they had a fever, all those questions. And it may be one that we feel like after you consult with your supervisor that there needs to be a face-to-face visit.
Okay, well, it looks like, thank you, Becky, and it looks like we are about out of time. I'm also not seeing additional questions, so I've tried to keep these short so that you guys can just join in and hopefully get some quick relevant information. If you have things that you would like me to share or address on the weekly call, I'm very open to that. I appreciate the areas who sent me some of the praises for their staff, and I apologize if I missed one and you're like, but Miss Shaw, I emailed you last week and I hoped you'd give a shout out. Well, just email me again. It wasn't intentional. But not only do I love hearing the stories, but if you also have suggestions or questions about what's happening out there in the field that you really think I need to address from a statewide perspective, feel free to email me, as long as you CC your supervisors too, to keep everybody in the loop. But again, I appreciate everything you guys are doing. And, you know, I really believe that we are all working towards the same value, that every child deserves a safe, stable family. And that doesn't change the public health emergency. So again, I thank you guys for all that you are doing, and I will talk with you next week. Bye, everybody.